JAIM Journal Club. I'm Dr. Charu Sharma and I welcome you all on the behalf of our whole team of JAIM. And we have completed 1.5 years in this journey, and this event is being successfully organized by the team under the leadership of Girish Dillu sir, Supriya madam, and Kishore Patwardhan sir. So last month we had this very interesting discussion on the preparation of Swarnamakshik Bhasma, the alternative heating method versus the traditional Tarhapur. That was presented by Dr. Arati. About a clinical trial, usually what happens when we discuss cases that we usually go for a clinical discussion. But when we are talking about a journal club, we try to understand the methodology, the outcomes of research, and then we further analyze it. So it helps us to understand the research papers. And in this presentation, a speaker actually dissects a paper in every sense. So that's the main idea behind conducting a journal club. The discussion is mainly based on the methods, the presentation of the data. When we talk about a clinical trial, what we see is a convergence of a researcher's mind and a clinician's mind. And this is an opportunity for a clinician as well to know about the research methods. And we have our presenter with us, Dr. Maitri HS. She has done her post-graduation in Kai Chikitsa from All India Institute of Ayurveda, and currently she is working as an assistant professor and consultant physician, FIMS SGT University. Today she is going to present the paper, Safety and Efficacy Patients with Renal Calculi, a 28-week randomized double-blind placebo-controlled parallel group study. And I would also like to welcome our expert panelist for the session, who is also the lead researcher in the trial that we are going to discuss today, Professor Dr. Suresh Balakrishna Patankar sir. A very warm welcome, sir. Namaste. Sir is an established neurosurgeon, a researcher, and an academician. So that what defines a physician scientist, as Vaidya sir also says that when we are talking about science for Ayurveda, then we need Vaidya scientists. And in the same way, in clinical medicine, we need physician scientists. Sir is the founder, trustee, chairman at AMAI Charitable Trust, ACE Hospital, Pune. Professor and head of Department of Urology, BJ Medical College. And after completing his BMS, sir did his MBBS from Bombay University, followed by MS in General Surgery in 1980. Sir has published various research articles in numerous national and international journals, has more than 10 patents to his credit, and he is the only Indian researcher to be granted maximum number of patents on research in ancient as well as modern science. We welcome you, sir. Namaste. With the due permission of panelists, I would now like to invite Dr. Maitri for her presentation. Hello, Dr. Maitri. We welcome you all. We welcome you here at the event.
Thank you. Thank you so much, Dr. Charu. Is my screen?
Yes. Yes, Dr. Maitri, yes.
Just a second. Yeah, with due permission from the expert speaker, Dr. Suresh Patankar sir, and all the panelists present today, I would like to start my presentation. Is my audio quality proper, Dr. Charu? Is it well audible?
Yes, Dr. Maitri, please go ahead.
Okay. So today here we are at the Journal Club, JAM Journal Club meet. That is the 18th session of JAM Journal Club meet. And we'll be discussing about the paper, Safety and Efficacy of an Herbal Formulation in Patients with Renal Calculi, a 28-week randomized, double-blind, placebo-controlled, parallel group study. So today's whole presentation will be going in parts, in two parts, that is in section 1 and section 2. In section 1, we'll be discussing about the original published paper as such. And in section 2, we'll be trying to critically analyze the paper in its methodology, its assessment criteria, AM journal of the first quarterly issue of 2020. The paper as such, the manuscript was submitted in the year 2017, and it was accepted in 2018, and it was made available in the year 2019. And here we can see the author affiliations too. All the authors, all the 4 authors of the paper, they belong to the AS Hospital and Research Center, Pune. And the CTRI number and clinical trial identifier number as given by the authors in the paper as such has been displayed here. So here in the first section, we'll be getting to know about the rationale for conducting the study. That is rationale, why this particular disease was chosen for the study, and why this particular system of medicine, that is Ayurvedic herbal formulation, was chosen, and why the present drug, that is the Subab Plus, was chosen for the present study. Here authors, they go on explaining about why there is the need of studying on urolithiasis. That is, they give numerous references telling that the lifetime risk of developing a urolithiasis, it ranges from 10 to 25%, where 10 to 15% is seen in the Western world, and it can go up to 25% when it comes to Middle East countries. And asymptomatic calculi, which is the case criteria which is taken in the present trial, they often go towards the alternative system of medicines. And also another chief criteria to do the study was the recurrence rate. That is, the authors cite some of the papers which tell that there is a 10% recurrence rate in first year, 33% in 5 years, and 50% recurrence rate of urolithiasis when it comes to 10 years of follow-up. And also the authors tell that why there is an increased incidence of urolithiasis in the coming era, that is due to a change in biological clock as a result of modernization. And they also tell why the traditional system of medicine has to be taken forward towards further studies. That is, the increasing use of traditional therapies, they demand highly significant sound evidence and for evaluating the therapies, and this can be done by validating the reverse pharmacology. And the authors state that in the concept of reverse pharmacology, the safety remains the chief concern, and the proving the efficacy, it is just a matter of validation. And also that is the current treatment protocols which are available for urolithiasis. Even after taking those treatment protocols, there is a risk of residual stone or stone fragments. And also there is, the authors quote some of the papers which state that 77% of the patients, they showed disease progression, and 20 in the next 3.26 years. And in the same study, it was stated that nearly as much as 50% of those patients, they required intervention in next coming 7 years. And also the authors have quoted that there is reduced compliance for treatment when it comes to therapy among the events of adverse drug or adverse events when it comes 7 to 17%. So coming to why this particular Subab Plus medication was used as a trial drug, that is in an earlier study which was conducted by the same group of authors of the present paper. They have done a study on the drug HerbMed, which contained 2 drugs, Varuna and Kadali, and it showed 33% of reduction in the calculus size of 5 to 10 mm and 11.25% reduction in the calculus of more than 10 mm. And in the earlier study, that is in the study of HerbMed, the treatment period was only for 3 months. And the authors state that the medicine should have been given for a longer duration. Hence, to overcome that limitation of the previous study, the authors have taken the treatment duration to be 6 months in this present study. So this is the previous study from where they have taken the validation, that is the HerbMed. Here the study was done for 3 months, and the inclusion criteria was the stone size which were more than 5 mm. And in group A, there was 33.04% reduction in the size of calipuli in the active arm, and there was only 5.13% increase in the same group and in the placebo arm, and also the 11.25% reduction in the active arm and 1.41% reduction in the same group with placebo treatment. So going on to the next part, where the authors describe about process of manufacturing the drug, that is Subab Plus. Here it has 4 main ingredients. One is Varuna, mixed is Kadali, Yava and Apamarga. So here Varuna they have used as Varuna Churna, and other 3 drugs are used in the form of Kshara. First, they have taken the Varuna Churna dried stem bark, and the powdered Varuna is mixed with water and boiled to form the Kwatha. And this Kwatha added to the Varuna Churna, and it was kneaded well to get the Varuna Bhavita Varuna Churna. And this was followed by stem of Kadali. It was pounded and grinded well to get the aqueous extract of Kadali. And this aqueous extract of Kadali was added to Varuna Bhavita Varuna Churna to get the final Churna composition, which was given Bhavana with both Varuna Kwatha and Kadali Swarasa. And after this, the authors explain that they prepared the Kshara of all 3 drugs, that is Kadali, Apamarga and Yava. And at last, all of these were mixed to get the final composition of Subab Plus. And it was in the dose that the Varuna Churna was in the dose of 250 mg, and Kadali Kshara in 75 mg, Yava Kshara in 100 mg, and Apamarga Kshara in 75 mg, in total making it to a capsule of 500 mg. So the authors have also done the standardization of the current Subab Plus product, that is the investigational product. And these all parameters what they have tested, it is as per the CCRS norms. And coming to the Churna, they have gone through and they have done the standardization on the basis of foreign matter, appearance, color, taste, alcohol extractives, loss on drying, pH, bulk density, and particle size. And when it comes to Kshara preparations, they have tested for appearance, color, taste, fracture, macroscopic and microscopic studies, alcohol extractives, organoleptic study, pH, and also for analysis of sodium, potassium, and ferrous. And coming to the whole formulation, which contain both Churna and Kshara, they have done a TLC, that is liquid chromatography. They have followed the method, and there was extraction by using the extraction of methanol and silica gel as absorbent, and solvent system in N-butanol, acetic acid, and water. And they have also done the preclinical acute and subacute toxicity studies in animals, that is in rodent models, as per the OECD guidelines. And the authentication of the raw herbs was done from Department of Science and Technology, Government of India, Pune. And these 4 herbal drugs, which were told as Varuna, Kadali, Apamarga, and Yava, they were botanically identified as displayed in the presentation, that is Cretiva novala, Musa paradisiaca, Acheranthus aspera, and Hodram vulgare. And these vouchers has been still, the authors say, claim that it has been retained in the research laboratory. And the heavy metal testing was done for the investigational product as per the NABL guidelines. And preclinical subacute and acute toxicity was established in rodents. And as per that study, the LD50 was said to be more than 2000 mg per kg, and NOEL was more than 450 mg per kg. And this efficacy of investigational product, that is Subab Plus, was established and confirmed in ethylene glycol induced hyperoxaluria rodent models. Coming to the study setup, which was done in the present trial, it was a clinical trial which was conducted between September 2010 to December 2013, and it was a prospective study which used the block randomization of 1:1, and it was a double-blind study where the both principal investigator and the patients were completely blinded about the investigational products. And it was a placebo-controlled study where lactose capsules were used as placebo. And the study has positively got approved by the ethics committee of ACE Hospital and Research Center, Pune. Coming to the inclusion-exclusion process which is used in the study, the patients who were asymptomatic at the time of first visit were screened, and eligible and willing patients were enrolled from the outpatient department of ACE Hospital, and patients visiting to the outpatient area with either ultrasound or KUB X-ray reports were also screened, and those with renal stones up to size of 4 to 9 mm were included in the study. And computerized tomography, that is non-contrast CT abdomen, was done to confirm the stone size. And in exclusion process, the patients with complications and requiring surgical interventions were excluded, and patients with high values of SGOT, SGPT, ALP, and raised HbA1c were excluded. And assessment criteria for these patients was done at the baseline, that is at the time of enrollment, at the end of the study. And the blood chemistry criteria, it included complete blood count, blood sugar, serum creatinine, blood urea nitrogen, serum electrolyte, serum bilirubin, SGOT, SGPT, total proteins, and HbA1c. And urine analysis was also carried out, which included both routine and microscopy. And the clinical assessment of the patients was done based on VAS scale, that is clinical assessment of pain was done based on visual analog scale, and expulsion and change in size and density of the calculi was calculated by CT, and size of the calculi, it was calculated based on surface area of the stone based on the length and width, and in case of multiple calculi, the cumulative diameter of the stone were calculated, and the density, that is the largest length and width intersection point to avoid the error, was taken with the help of Hounsfield unit by CT scan. And all the enrolled patients received 1 capsule of 500 mg, either herbal formulation or placebo, twice a day after the meals for 6 months. Coming to the statistical analysis, the sample size were carried out based on the earlier studies, that is the HerbMed, what we saw. And 30% dropout was expected, and calculated the sample size accordingly. And the statistical measures which were used were student t-test and chi-square test at 95% confidence interval. And this is the CONSORT flow diagram what authors have given. They went through almost near 120 patients and excluded 36 of them who did not meet the inclusion criteria, and 8 patients as they declined to participate in the trial, and 8 patients with other reasons. And a total of 84 patients were randomized into 2 groups. First group with allocation of intervention of 42 subjects, and placebo with another 42 subjects. And here in the treatment group, it was 500 mg 1 capsule twice a day after food, and in the placebo, it was 500 mg of lactose capsule twice a day after food. And follow-up was done every month to check the pain and also to check the expulsion of calculi, if any. And in the treatment group, there was loss of 5 patients during the follow-up because of discontinued intervention, where some of them required the surgical intervention. And in the placebo group, there were 8 patients who withdrew the consent, and they also discontinued the intervention. So at last, it was 34 patients in the treatment group and 31 patients in the placebo group who completed the trial for 6 months. And also the authors have clearly stated that there was no rescue medication which was provided during the follow-up, but patients were asked to take the tablet diclofenac sodium 50 mg whenever necessary in case of severe pain. And this is the baseline data what authors have quoted in the paper. That is, the patients with single stone were 37 out of 65, and multiple stones were there in 28 patients out of 65, and mean age of the patients were 39.24 years, and gender ratio was 2:1, that is male is to female ratio. And coming to the results section, the authors state that 7 out of 34 patients in the treatment group had the complete stone expulsion, and only one patient among the 31 patients who completed in the placebo group had the complete stone expulsion. And the VAS score was significantly reduced in the treatment group, that is from 6.9 to 1.8, and in the placebo group it was not significant, that is it reduced only from 7.2 to 6.8. That is also the p-value. Here we can see in the VAS score, when it comes to the treatment group, it was highly significant. And results pertaining to surface area and density have also been quoted by the authors. Here we can see in the placebo group, the density at the pre-treatment level was around 900, and post-treatment level it got increased to almost 1059, and it was a significant increase in the size in the density when it comes to placebo group. And in the case of treatment group, that is herbal treatment group, the surface area has also got reduced from 27 to 21 almost, and density also it got significantly reduced from 834 to 740. And results between the groups were highly significant at p-value less than 0.0001. And the authors state that hemogram and other biochemical parameters did not change significantly in either of the group at the end of study, and no major adverse events were noted in both the groups. In the treatment group, 3 patients had an episode of belching after consuming the medication on empty stomach, which got settled down after they were advised to take it after meals. And in the placebo group, 2 patients had the complaints of nausea. Coming to the discussion part of the original paper, here the authors explain in brief about the pathophysiology involved in urolithiasis, that is stone formation. Here they tell the nucleation as the initial step which occurs in the urolithiasis, followed by crystal growth, crystal aggregation, crystal retention, and at last the calculi formation. And here the authors explain why this specific drug was chosen, stating the reasons and the karmukata of the drugs which was taken here. And it is the authors state that the drugs have lekhana and vedana properties, mutrala, that is diuretic property, vedana shamaka, that is antispasmodic property, shothagna, that is anti-inflammatory property. And authors have also quoted numerous studies which explains the pharmacological activities of these 4 drugs which are there in the SUBA plus, and I have tried to put it in the form of a table for easier interpretation. And when it comes to the Varuna, it is said to have anti-urolytic activity through anti-oxaluric and anti-calciuric effect, and it also regulates the action on endogenous oxalate synthesis by mediating the Na plus and K plus ATPase channels. And when coming to the next drug, that is the Kadali, it has got, interestingly, it has got a systemic effect as per the citations done by the author. That is, it acts on liver tissue by reducing the glycolic acid oxidase, and it reduces the level of oxalate and calcium. And Acheranthus aspera, that is the apamarga, it inhibits the action of calcium oxalate nucleation. This is another interesting part where Acheranthus aspera is said to act at the initial phase of the stone formation. That is, it inhibits the nucleation of calcium oxalate itself, and also it prevents the supersaturation of urine and decreases the crystal size. And the Yava, what is told, it is said to have an anti-inflammatory action, and it also increase in the urine citrate excretion. And another interesting part what authors have quoted is from their earlier animal studies, they have said that there is renoprotective function for these 4 drugs found from the animal studies of HerbMed formulation. And the same data from the animal studies of current SUBA plus, it shows that the drug might act upon reducing the cellular injury and reduce the overall inflammation. Coming to the conclusion, what the authors have stated in their paper, in this exploration, the investigational product is exhibiting a promising anti-urolytic and analgesic activity due to synergistic effect of drugs. In the investigational product, it has reduced the size and density of the renal calculi significantly and also helped in expulsion of calculi. It has also helped to reduce the pain caused by renal stones compared to a placebo. And possibly this product could be a drug of choice in the future for small non-obstructive renal calculi and also in preventing the recurrence. So this was about the section 1, where we went through in detail about the paper as such. And here now onwards, we'll be doing a critical analysis of the current paper. First, we'll go through about the merits and strength of the paper, followed by the minor scope of improvisations required in the paper. And in the merit section, we'll be seeing the merits and strength of the paper in its methodology, its drug of choice. And when it comes to the improvisations, we'll be seeing it under the criteria of trial design, method and objective, assessment criteria, and outcome measures which were taken. So coming to the merits and strength of the paper, which is again a huge, which is giving a huge impact on the current Ayurvedic medical practice, because this study, what is published here and we are discussing, is the first study on Ayurvedic herbal compound formulation in the management of urolithiasis. This is the first published study on the Ayurvedic herbal compound formulation. And even though there was no as such direct reference for this formulation in the Ayurvedic text, the clinical trial is backed with the evidence of preclinical study, efficacy, standardization of product, including heavy metal microbial testing. The mechanism of action of this drug is also proposed by the authors based on both modern references, that is modern pharmacological actions, and also based on the references of treatises. That is all the four drug components which are there in the Subha Plus, they all have been mentioned in the Sushrut Samhita, Ashmari Chikitsa, not as a whole formulation, but single drug, all four of them have been indicated in Ashmari Chikitsa. And that is the paper has created a level 1 evidence for when it comes to the evidence of therapeutic studies. That is, it is a randomized double-blind and placebo-controlled clinical trial. Another biggest merit of the paper is that it mentioned the limitations of the study, which is again a very strong positive point for the paper. And it has managed all the 34 patients who were in the treatment group with only herbal medications without any reporting any adverse drug reactions. And another important merit of the paper is that the transparency of the study. Here the authors have clearly and significantly mentioned about the CTRA registration number, its IEC approval, and this shows how the study could be much more transparent in the era. And even though it was quoted earlier, like even though there was no direct reference for the formulation in the treatises, the study was well supported by a preceding animal experimental study, which was done on rodents. And it mentions the pharmacological actions of drugs also based on Ayurveda, like we saw it was telling about Bhedana, Lekhana, Mutrala properties of the drug. And the study has completely followed the guidelines of OECD, NABL and CCRA's guidelines, which were given for the standardization of product and for testing the acute and acute toxicity studies. And another biggest merit of the paper was that it has followed a very good quality of blinding. That is, the title itself says it is a double-blind placebo-controlled trial. Here, the authors clearly states that all that is randomization, enrollment, assignment, and even the follow-up studies, it was done all by the healthcare workers which were not directly involved in the study as such. So this shows how the authors maintained a very good quality of blinding throughout the study. And coming to the data, what we got when we went through the previous papers, and those papers, they have told that there are numerous mechanisms involved when it comes to the formation of urolithiasis. And here the authors have focused mainly upon on the hyperoxaluria induced urolithiasis. That is what is they have checked in case of rodents in the animal studies. And some of the publications, they state that whatever drug, medical drug which is used for treating the urolithiasis should have these 5 properties. That is a kinetic property, incubation property, antispasmodic, anticholinergic, and diuretic activity. And when we check the Subab Plus, the investigational product, which has 4 main components, Varuna, Kadali, Apamarga, and Yava, and all these 4 are said to qualify all these 5 criteria which is needed for treating a urolithiasis patient. So this again is a very big merit and strength of the paper. And moving on to some of the scope of improvisations which might have been followed during the trial. That is rationale for selecting a study design as placebo controlled study. Because whenever there is a previously available well-established treatment for a certain condition, it is not much advised to follow a placebo controlled trial, as it violates the clinical equipoise. And if this placebo controlled design was to be used, instead of that, it would have been done as an add-on trial where previously established drug would have been given in the both group, and the HerbMed Plus, that is the Super Plus, could have been added as a add-on drug. And also some other trial designs like early escape or play the winner would have been employed. And some more clarity about the risk and benefit analysis could have been justified in the paper. And also the rationale for including the asymptomatic patients. Like when we went through the previous studies, we could find some of the studies which told, given the overall stability of the asymptomatic stones, they advocated the initial observation and treatment reserved only for those patients who had a symptomatic event, So some other paper, they also quoted that only 24% of the symptomatic patient, with 19% of them requiring the surgical intervention, went in the follow-up years, and not a single patient required intervention in the first 2 years. And also the location and type of the stone was missing in the paper when it comes to the description of the stones. That is some of the papers stated that proximal urethral stones up to 5 mm had a spontaneous expulsion up to 98%. And 4 to 6 mm, the stones with 4 to 6 mm size had a complete passage and 60% passage rate in the 22 days, and 48% of passage rate in the case of stone up to 7 mm. So this could have been rectified like by mentioning the severity based on number of episodes, recurrence rate, location, or type of the stone. Coming to the possible biases which could have happened in case of the trial, in the particular trial, is the attrition bias. That is the statistical analysis was done for the 65 patients, because it was a randomized trial where 84 subjects were randomized into 2 groups, where only 65 could complete the trial, and only the statistical analysis was done for these 65 patients who completed the trial. So that is instead of doing the statistical analysis on all the 84 randomized patients, it was done on the 65 patients who completed the trial. And also the reporting bias, where there is selective outcome reporting, that is reporting in detail about the rescue medications, was a bit lacking. And this could have been, that is the reporting bias could have been amended by telling that subjects who use the rescue medications and reporting clearly about the time taken for stone expulsion. And another bias was about the diet and lifestyle restriction, which can be a confounding bias, where the published papers from the Canadian Urological Association, they state that recommending a strict common diet and lifestyle advice is highly recommended of grade A to C, and it is said to be an evidence of level 1 to 3. And based on the CTRI number, we could retrieve the CTRI registration of the present trial. And here the drug, name of the drug is said to be HerbMed Plus, that is the thing used in the clinical trial, and the duration of the trial is said to be 28 week, that is 210 days. But when it comes to the trial duration, it has been mentioned that the drugs was given for 6 months, that is up to 240 days. And here we have tried to assess the primary and secondary outcome measures which were taken in other previously done randomized control trial in case of urolithiasis. In those studies, the primary outcome measures which were included were stone recurrence rate and change in size of renal stone. And when it comes to other blood biochemistry parameters, it was serum calcium, serum uric acid, and serum uric acid, hepatic enzymes, and serum electrolytes. And other urine biochemistry parameters included uric acid and creatinine clearance rate, and urine excretion of calcium, oxalate, citrate, creatinine, magnesium, and like magnesium, sodium, and potassium sulfate, phosphates, etc. And when it comes to the radiological investigations, X-ray KUB, ultrasound, and CT abdomen were the primary outcome measures which were included. And the secondary outcome measures were like reporting the severe adverse events. And some studies, they also included urine biochemistry as secondary outcome measure, VAS scale, and change in stone number and in in-plane diameter change was also a secondary outcome in some of the studies. And other secondary outcome measures included CBC, assessment of urea, creatinine, FPS, total and ionized calcium, beta HCG in females, total cholesterols, GGT, amylase, and bilirubin levels. Coming to the analysis of the trial as such and its outcome measures based on the pie chart, that is for the population, the sample size is clearly mentioned in the paper, and the sample characteristic, that is while mentioning the inclusion and exclusion criteria, it was a bit not clear in the paper. And also when it comes to the intervention treatment, about the authors have very clearly mentioned about the treatment, that is the options, that is treatment option given in the intervention group and the placebo group. And when it comes to duration, there was a little bit of ambiguity between the manuscript as such and the CTRI registry, and those again is very clearly mentioned in the paper. And the comparator arm, a very clear description of the placebo with stores has been given by the authors. And outcome measures, that is outcome measures have been mentioned clearly in the CTRI registry, but when it comes to the manuscript as such, the mentioning of the outcome measures was a bit lacking. And coming to the validation measure and relevant and familiar outcome, it is yes, and it is completely mentioned. That is the familiar outcome of CT abdomen, USG, VAS scale, everything have been included by the authors in the study. And here onwards, for the next few slides, we'll be talking about the CONSORT guidelines. This is a 25-item checklist which is proposed by the Equator Network, and it is for reporting the standard. It is for checking the standard of reporting of the parallel group randomized trials. And here we'll be going through the whole paper based on the checklist items provided by the CONSORT guidelines. And the CONSORT guidelines, we have also included some of the extensions which include specific items for herbal medicine, pain trials, and some of the traditional medicine trials. So while going through the CONSORT guidelines related to this paper, it is a very big yes, because most of the points which are there in the CONSORT guidelines have been mentioned in the paper. Like out of 25, almost 15 to 17 points have been clearly mentioned by the author in the present paper, while some of the minor points, they have been lacking a bit clarity. like in case of mentioning a specific objective or a specific hypothesis in the present paper, and also like while mentioning the eligibility criteria, that is some of the published papers, they say that urolithiasis is a manifestation of metabolic disorder. So some of the conditions like osteoporosis, hypothyroidism, and hypertension, all those cases have to be excluded while taking the patients or while enrolling the patient for urolithiasis. So those eligibility criteria was a bit lacking in the paper, and completely defined and pre-specified primary and secondary outcome measures. As we saw, it was mentioned in the CTRI registry, but it was not there in the manuscript as such. And the method used for generating the random allocation sequence, whether it was a hybrid allocation, pseudo allocation, or quantum random allocation was used, it was not clearly mentioned in the paper. And the statistical methods used, like statistical methods used here were chi-square and student t-test. And to report the significant results which are found between the group, the authors could have mentioned some other statistical tests like Mann-Whitney test, Wilcoxon sign rank test, etc. And the dates define the period of recruitment and follow-up. Like we saw again in the CTRI registry, it was around 210 days. And the manuscript as such, it was about 6 months or 240 days. And the table showing baseline demographic and clinical characteristic of each group was a bit lacking in the present paper. And again, a big positive point was mentioning the trial limitations, but some of the potential biases have been left out in the manuscript while mentioning it as such. And this is the CONSORT checklist, which is specific to herbal medicine. Here we have tried to include the points which were extra or specifically mentioned in this herbal medicine CONSORT guideline. And here we can see all the points are a big yes. All the points are very well mentioned in the paper. That is about the Latin botanical name, the proprietary product used, and the parts of the plant used, and the type of the product used, that is raw or fresh herb. And all the points are very clearly mentioned in the paper. And continuing the concept of the herbal medicine, here the point 2, when coming to the dosage regimen and quantitative description, the weight and concentration of the drug is mentioned, but there was a bit lagging in the mentioning about the any excipients, binders, or fillers used in the capsule. And the product's chemical fingerprint and methods used, and who have performed the chemical analysis. The authors have clearly mentioned about where they did the standardization process, that is which laboratory was used, but the product's chemical fingerprinting was a bit lacking. And the rationale for a type of placebo use, that is we saw in the previous slides also, that is a rationale for using a placebo control. And this is the CONSORT extension, which is for traditional Chinese medicine. So here we can take some of the points from this, which can be relatable to the Ayurvedic system of medicine as well. Like in the point 1C, the determination of appropriate keywords, like including Chinese herbal medicine, what is there in the checklist, like including Ayurvedic herbal formulation or Ayurvedic herbal medicine in case of keywords. And a statement of whether the formula targets a Western-based disease or a traditional medicine-based disease, that is whether it is targeting urolithiasis or whether it is targeting Ashmari as a disease as such. And the TCM pattern, that is statement of whether the participants were specifically enrolled based on the diagnostic criteria of a traditional medicine pattern, that is based on Ashmari or based on the urolithiasis. And when it comes to the next point, that is intervention, all of the points are very clearly mentioned. That is about name, source, and dosage of the formulation, and the processing method, authentication method which was used, and principles and rationale for selecting the drug. All these things are very significantly and clearly mentioned. and the discussion on how the formula works on different TCM patterns. That is how the present Suba plus could be useful in other diseases of Ayurvedic system of medicine. That could have been added a bit more, like is this valuably used in case of Prameha or Mudrakritra, etc. This could have been added as another interpretation in the paper. And coming to the last CONSORT extension pertaining to the pain trial, as VAS was used as an assessment criteria here. So we'll be going through even this also. So these are some of the extra points which we could get from the CONSORT extension of pain trial, while a clear definition of eligible participants, patients with comorbid pain conditions or mental health condition could have been excluded to rule out that placebo effect, and also training the investigators to minimize the participant expectations by explaining them that the efficacy of the treatment is unknown, and by this it may also reduce the placebo response in both the groups. And when it comes to outcomes, that is in pain trials, often self-reported measures like VAS are used, and to enhance the quality of the reporting, the instruction to focus on pain intensity independent of the mood and pain interference with activities could be advised to patients, and this could minimize the false interpretation of the subjects. So this was in detail about the paper, and we analyzed it based on even the CONSORT checklist provided by the Equator Network. And so this was about the paper as such. But when I think as an Ayurveda physician about the paper, it gives, as a younger generation of the Ayurveda physician who do not have much experience in the clinical field for now. So I feel this paper has greatly motivated the younger generations to become the Vaidya scientist, and how they can conduct a clinical trial in a well-structured manner. And also the paper have highly highlighted the importance of documentation. Like when I went through the present drug Suba Plus, and it's in the internet also, like the authors and the main investigators, they have maintained a very good resources. Like they have maintained the newspaper coverings, the media coverage, the patent information of the drug, and also the patient testimonials. So all these things, they highly motivate the coming generation to have a structured documentation of the documents related to the trial. And also the paper very highly emphasizes how the good quality of blinding can be done, and how to conduct a good quality of placebo trial. Like when it comes to Ayurveda, again, it is a bit tricky to follow a placebo trial. But here, the authors and the lead researchers, they have followed a very effective method to conduct a placebo trial. And also how to establish the evidences when it comes to Ayurveda, that is very clearly mentioned. That is how the references from the text can be taken to the actual practice, and how it can become an evidence-based practice. That is again a very big take-home point from the present paper for me as a Ayurveda physician. And yes, again, the drug is patented, and it is very effectively and easily available in the market also for treating the urolithiasis patients. So at last, I would like to extend my acknowledgement to each and everyone who have motivated me and were there with me throughout the preparation of the presentation. Firstly, the authors of the paper, that is lead researcher Dr. Suresh Patankar sir. It would never have been possible without the such a detailed description in the paper itself, and it has been a very great learning experience going through the trial as whole. And also I would like to extend my thanks to the members of the JAM journal, Dr. Supriya Bhalerao ma'am, Dr. Girish Tilu sir, Dr. Kishore Patwardhan sir, for giving their valuable time Even though they were busy, they were always available for me whenever I had any doubts, and they were always there to refine the presentation. And I would also like to thank my mentors and guide, Dr. Anantram Sharma sir, Dr. Pratibha madam, Dr. Nitin Krishna sir, to continuously refine my presentation and point out my mistakes whenever I had it. And also, I would like to extend my gratitude towards the conveners of today's session, Dr. Vinay Pawar sir and Dr. Charu Sharma, for giving this opportunity and for smoothly conducting the session. Thank you so much.
Thank you, Maitri. Thanks a lot. First of all, I would congratulate Dr. Maitri for this wonderful presentation. She has taken so much efforts for both the sections actually. The first section was a bit easy, but the second, she has taken so much effort for the second session of critical analysis. She has gone through CTRI actually for the registration of trial. She has gone through Equator in network CONSORT guidelines provided by Equator Network, and just checklist, just check the paper on that checklist, and she has taken so much effort. And the presentation good, and the limitations of the study were presented in a very nice manner. Thank you, Maitri, for the presentation. And as Maitri mentioned, that it was the first study conducted on Ayurvedic herbal compound formulation in the management of urolithiasis. And therefore, and as the formulation is not mentioned in any of the ancient texts, therefore it was supported by so much evidences. They are all given in the paper, starting from the authentication of raw drugs to standardization of drugs. Then am I audible? Standardization and quality control, preclinical study, even all heavy metal testing was also done for the formulation. And as Dr. Charu mentioned in the beginning of the presentation, that sir is physician scientist in true sense, and that can be seen from the paper also. So we have with us principal investigator of clinical trial and first author of the paper, Honorable Dr. Suresh Patenkar sir. I would request sir to present his views on the paper and overall presentation by Dr. Maitri. You are not audible, sir. माइक सुरू करा, अनम्यूट करा माइक वर. माइक आहे बघ तुमच्या लेफ्ट हँड साइडला सर, लेफ्ट हँड साइडला खाली आयकॉन आहे ना माइकचा.
Yes, sir, you are unmute now.
Thank you so much, sir.
There is some technical error. So you have been presented with certificate of participation, Dr. Maitri HS, for this wonderful presentation. We invite participation from PG students, researchers, faculty as a presenter for the next journal club. Please email your interest along with a statement of intent and 3 articles of your choice to editor.jim@gmail.com with the subject line as participation in JIM Journal Club. So we request all PG students and faculty to send your request to be presenter in the next journal club. Thank you.
Over to you,
Hello,
sir.
sir. Hello. Somebody is asking that can we have the recording of this presentation? Yeah, absolutely. You'll get the recording of the presentation on our JIM site. Participants can post their question in question and answer section.
Okay. Meanwhile, let me add something
Yes, sir.
on the questions posed by Dr. Reshma. Reshma asks a question that is attrition bias. I mean, the way participants leave the study, and the attrition bias, she says that happens only if authors wishes to give intention to treat analysis. Reshma, attrition bias is not only restricted to intention to treat analysis, but attrition bias is all about if authors fail to describe reasons of attrition, right? And the reasons for leaving the study, lost to follow, if they are different in both the groups, then that has to be investigated and mentioned. Another component of your question is both the type of analysis, intention to treat analysis means those who are randomized, and per protocol analysis means those who are completed. Both the type of analysis, they are expected to be mentioned in the paper. Another question by Dr. Rasika is, can we use tablet when the stone is greater than 7 mm? I think Patankar sir will be the appropriate person to answer this question. Over to you, sir.
To you, sir. Dr. Patankar, sir, you are not audible. Still, you are not audible. सर लॅपटॉपवरून जॉईन करतायत तर मग माईक सुरू करा ना. नाही होत, नाही येते आवाज.
We also have Dr. Kishore Patwardhan sir with us. Sir, if there are any comments from your side.
No specific comments. I would like to congratulate Dr. Maitri for having given a wonderful presentation. She has done a wonderful job because she presented the paper as such, I mean, in her own way, and her efforts were visible, clearly visible, and also she analyzed in a very meticulous way, and the subject being different from my own field of expertise, I won't be able to comment on the papers as such. But yes, this is this I would like to state that this is a ideal kind of presentation in a journal club. So that's all I had to say. Thank you.
Thank you so much, sir.
Thank you, sir.
Hello, sir.
Hello, sir.
So Maitri, I have a question for you. What were the outcome measures assessed in this study, and outcome measures, especially primary and secondary outcome measures, what you have read from other similar trials?
Like in this present study, just a second. So, sir, in the present study, the primary outcome measure which was used was reduction in stone size, stone density, and expulsion of stone, that is complete expulsion of stone. And the secondary outcome measure which was used was, it was mentioned in the CTRI as painless expulsion of stone. So that was a bit ambiguous there. But in the previous studies, what I went through, they had used stone recurrence rate and the change in size of renal stone as primary outcome measure, and other urine biochemistry criteria like uric acid levels, serum, creatinine clearance rate, and other urine excretory measures like oxalate, citrate, creatinine, magnesium, sodium, and potassium sulfates, and other blood biochemistry parameters like serum uric acid, hepatic enzymes, and serum electrolytes were used. And other radiological investigations like KUB X-ray, ultrasound, and CT abdomen were used as primary outcome measures. And the secondary outcome measures were like reporting the severe adverse events and change in stone number and VAS scale, and other criteria which were special and secondary outcome measures were like beta HCG in females, and total cholesterol, and total triglycerides, GGT, amylase, and bilirubin levels were taken, sir, in previous studies.
Thank you, Maitri. I think Dr.
Hi, am I audible now?
Yes, sir. Yes,
Yes,
sir.
sir. Perfect. Thank you. Yes, sir.
Sorry for all this trouble. This
problem.
my
No problem.
I am on my mobile.
Yeah.
And first thing, let me congratulate Dr. Maitri. She has an excellent job.
Thank you, sir.
Very good analysis. I never could imagine such a high level of journal club activity. Really, congratulations to all of you. Just a lot of pains Especially, I like the critical analysis what she has done. Means for a researcher or a author, you always feel he had done a complete job. But when you come out with a small thing, you look for it. It is very difficult, I'm sure. She has put a microscope to look for the limitations. But that is how one has to. Then only I'm sure Ayurvedic therapeutic trials, especially very difficult to publish. Very difficult to publish, especially therapeutic trials in Ayurveda in any of the modern journals. That is one thing I just want to say. Have to look for any citations of this paper.
Yes, sir. I saw like
So what are
citations.
they? Yes.
There was 3 citations for this paper when I looked. So I might have missed, sir. So please throw some more light on this, sir.
Because this is how we progress. Because this was the first trial of its kind. We couldn't get any literature survey for this. And secondly, I just want to point out one thing: asymptomatic stones is where many of them, let's say even 26%, they do require treatment. And this is where the Ayurveda comes to help. Because otherwise, in modern medicine, there is no comparator for any stone treatment. And I want to establish that Ayurveda can treat certain conditions which cannot be addressed properly by the modern medicine. The potassium magnesium citrate is just corrects the citrate level of hypocytriuria. That is the only drug available. And we want to establish here that Ayurveda can be used to treat a small asymptomatic stone. Because when they become symptomatic, you may have to undergo surgery. I mean, that is the reason we do not want it to jeopardize. Or somebody wants to say that you are treating a condition which may jeopardize the patient's health. So this was one of the reasons we took a symptomatic stone. Second problem, what we face is standardization. The facilities are sparse in our country. We try to do the best possible standardization, but still to publish any trial in a good journal, especially other journals of alternative medicine, they ask a lot of evidence. This is what I have presented is not sufficient, let me tell you. But those facilities are not available. If really Ayush department helps in this matter, then only we'll be able to publish. You mentioned about TCM, the traditional Chinese medicine. There are a lot. This was just a trial, a humble attempt on our side to establish the role of Ayurveda in integrative medicine. And I mean, we generally in my practice I look for situations where the Ayurveda come as a supportive treatment. We don't want to compete with modern medicine. One should not do that also, because there is no point fighting on the same issues. It should be run like a parallel lines, and that is how I think probably I look at it towards Ayurveda as a integration of modern and Ayurveda. Thank you very much. I done.
Thank you, sir.
Thank you.
Actually, this is the first time when we are inviting an author as an expert. And the most important thing is the author appreciated the criticism on that particular paper. And this is this scientific spirit. And I think if we have all this spirit, then only things can really progress. So thank you very much, sir, for sharing your comments. There is a question. What about stones greater than 7 millimeters?
I tell you the rationale of 4 to 9. Why 4 to 9? That question has not been asked for it. Generally, evidence says less than 4 mm stones can pass out spontaneously. More than that, the chances become less. The ureter diameter is around 3 to 4 millimeters. So by any means, it can widen almost 100%. That is 4 to 8 mm. So that is the reason. More than that, centimeter size stone passing out is scientifically looks difficult or impossible, you can say. And that is one of the reasons we selected 4 to 9, because more than that, then your claim becomes more impractical. That is the reason we say 4 to 9. And especially the point which was, I think, asked about ureteral stones. Yes, stones in the kidney take longer time than the stones in the ureter. Generally, the stones in the ureter expulsion is very faster and painless with the Ayurvedic medicine, because hematuria, pain, inflammation, they cannot be controlled by any of the standard therapy as compared to what we see in our Ayurvedic medication.
Yes, sir. So there are two comments on this particular study, actually 3. First, the site of the stone, can we also consider the site of the stone and do some subset analysis possibly on placebo group and the treatment group? If you can just again look at, and that will be again interesting, because as you said, that depends on site, because stone near to bladder are likely to pass than those are in the renal calyx or midway indicator. That is one. Another comment is on conclusion. Sir, in conclusion, you said that this particular medication may be effective for avoiding recurrence, but our study objectives, they are not on recurrence. So this conclusion is not right, actually supported with data. That is one. And why you think that this can avoid recurrence?
One moment, just give me.
Yes.
One moment, just one moment. There is one, you can say, way of analyzing lithorisk. Lithorisk is a panel of certain tests, and it tells you about the level of citrate in the urine, level of oxalates, level of sulfates. It tells you about the level of magnesium and saturation index. We are going to publish another paper where we have done a study in 2 groups. Again, it is a placebo versus drug. And what we have observed in lithorisk, the particular medicine corrects the citrate level, corrects the magnesium level, corrects the oxalate level, which is the most important part of this, and it reduces the saturation index. So that is the reason we say possibly this can be a drug of choice for correcting a recurrence of stones. Now here I would little divert my attention to all the participants, because this is not a particular journal club. Recently I conducted one study that stone recurrence or stone formation is a metabolic syndrome. It is not related to anything particularly, you can say, lot of spinach and cucumber. It's, I mean, that concept is probably obsolete according to me. Basically, it pertains to the metabolic syndrome. And in metabolic syndrome, liver, you see, there is another research we are doing it. Role of fatty liver and stones, or even case of diabetes, ignored by the modern medicines, unfortunately. You will see, you do a UAG for routine examination, you will say fatty liver. You go to a doctor, he will say nothing to worry, just a fatty liver. सबको होता है, कुछ डरने की बात नहीं है, थोड़ा चर्बी कम खाओ, reduce the fat, do exercise. No, the liver is the main cause for on metabolic syndrome. And fortunately, another trial we are conducting, just to share with you, the role of herbal extracts in correction of fatty liver. So this, with the now the management is shifting, and as Ayurveda talks about holistic approach, and this is what ultimately will be taken even by the modern medicine. This is to share you my additional information, my thought process to all of you. I mean, you must have seen fatty liver in many patients, and how many of us we treat? A cardiac patient having fatty liver, a cardiologist give only cardiac drug. I mean, he doesn't look at the liver. That is the main reason we talk about Jatragni, Bhutagni, Dhatwagni. That has to be corrected. You just correcting one Agni or one system is not going to correct the problem. You have to look holistically. This is just my one observation. I'm working on this. Thank you.
Yes. Thank you. Another question, because this is again unrelated to this particular paper, but we take this opportunity to have your thoughts on diet and lifestyle changes. For example, it's very easy to practice interventions such as Grutapan, means these are mentioned by Ayurvedic classics. So are there any plans to implement such kind of home-based interventions for smaller stones or avoiding recurrence? And can you also think of having such a trial?
Very absolutely true, Girish. Very good question. If you ask me, day by day, I'm realizing the value of Ahar and Vihar, Patya Patya. I think that is a mainstay to prevent most of the diseases. What we talk about lifestyle, we keep on talking about lifestyle. What do you mean by lifestyle? Lifestyle is one which has been described by our traditional systems of medicine. That is the way one can go about it. Why you get so many stones, diabetics, hypertensives, cardiac? It is all because of the lifestyle. And how you are going to prevent it? Not by drugs, not by taking statins, not by doing angioplasty, not by doing anti-diabetic drugs. You are treating the effect. You are not treating the cause. And that is how only unfortunate part of this, you recover long-term study, because Ayurveda is a way of life. You have to do a long-term epidemiology studies. And once you prove this, that cohort you have to select, and then you establish the value, then it will be accepted as a mode of treatment in therapeutics, I would say. I mean, this is a very good suggestion. In fact, I have tell all my patients, don't come to me, observe your diet, do exercise, follow that. When it is becoming a big way for lifestyle diseases, allopathy is no answer.
Yes, thank you very much, sir. Another important point related to this paper, I wish to point out. Of course, Maitri has given many process pointers. For every paper, the important part related to competing interest and what authors group is actually involved, and what are their relationship, considering financial aspects, considering intellectual property, etc. That has to be very clearly mentioned. And this particular study presents competing interest statement in very elaborate way. And that is the way, especially when industry related studies or studies on patented formulations or products they are reported, we need very detailed competing interest statement, acknowledgement, sources of funding, declaration, and that has been very clearly mentioned by the author, that we must really mention. Another important point is, although patients were selected asymptomatic patients, but considering the course of the disease, the pain VAS is included as one of the outcomes, because that is very relevant and practical. There is also another important message. Over to you, Charu.
Thank you, sir. Sir, there's another question by Dr. Alam. The type of stone that has been considered in the trial. That's the question, sir.
You know, one of the limitations in this trial is stone analysis. Now, stone analysis is available only when you expel the stone. And whatever these 3 or 4 patients in our study, we have done the stone analysis, but it is such a small number, we really cannot comment about it. Now, here I would like to mention one point very candidly about Ayurveda and the stone dissolution treatment. Now, a very good investigation available, that is CT scan. CT scan tells you about HU unit. You must have seen the density of the stone. Generally, 500 and less is a calcium monohydrate stone, calcium oxalate monohydrate. Above 500, it becomes the calcium oxalate dihydrate, which are very hard stones. Even in our practice, when we do laser treatment, we see some stones are very hard, some are very soft. To my mind, the stones which are softer, monohydrous stones, can be dissolved or can be expelled quickly without any complications by the traditional systems of medicine. Not the hard stone, because sometimes we have seen a 5 mm stone. Today morning only we did one procedure on a 70-year-old girl. For 15 days she was having continuous pain. The stone was just 5 mm. So when we did her ureteroscopy, we found the stone was small but very hard. It took almost 15 minutes for laser to break it. Now these are the stones cannot be treated by our Ayurvedic treatment. I'm sure density is one of the things. So whenever my suggestion for all the Ayurvedic doctors that if you are treating any stone, just look at the density. If it is very hard, don't try to or don't give a very unlimited period for dissolution. But this is just an practical observation which I want to correlate with the therapy.
Yes, sir. Thank you so much, sir.
Thanks a lot, sir. Your views means what Ayurvedic physicians and modern physicians, they look to one disease entity from one side only, and you can see the thing or you can see the disease treatment part from both the sides, and that is the advantage we got from your presentation, from your this speech also, sir. Thanks a lot, sir, and it highlighted the integrative approach which you give for your treatment in urological diseases. Thanks a lot, sir, for enlightening us on this topic, and it is one of the best examples of evidence-based medicine, actually. So, thanks a lot, sir. Thank you, Maitri, for the presentation. Over to you, Dr. Charu.
Thank you, sir. I would also like
one
to...
more thing. We are about to publish our trial on fatty liver. We are just finished the trial. We're analyzing it. I would certainly like you to go through this, and Girish, this is my humble request to put it for journal club when it gets published.
Yeah.
Thank you very much, sir. Thank you.
I learn a lot. I must say. Really. Yeah.
Thank you, sir. We all.
Yeah. Okay.
Thank you for your presence and comments, sir.
Can you leave now, Girish?
Thank you so much.
Yes, sir. We are about to conclude in a minute. Maitri, yeah. Yes.
Thank you,
Yes,
Dr.
Charu.
Maitri, again, and you have done a wonderful job. And the way you analyzed each section, that was very thought-provoking. At the same time, it has given guidance to many of the students who have joined us. And thank you for the same. And I would also like to inform that the next month we are having with that journal club meeting that we're going to have. We are going to discuss effectiveness of ginger on pain following periodontal surgery, a randomized crossover clinical trial, and that will be presented by Dr. Reshma from Amrita School of Ayurveda. And we also invite participation from PG students, researchers, faculty as a presenter for the next journal club meeting. And you can mail your interest, the articles of your interest to editor.jaim@gmail.com with the subject line as participation in JAIM Journal Club Meet. And thank you. Girish sir, is there anything that you would like to add on, sir?
Nothing. Thank you very much, Maitri, for your efforts. Thank you, Charu and Vinay, for nicely conducting this journal. Thank you very much. Thank you, Kishorji. Any comment, Kishorji? Oh. Thank you.
Thank you, sir. Namaste.
Thank you. Thank you all.
Thank you. Today is World Book Day, and let us cultivate habit of reading more. Thank you very much.
Thanks all. Thank you. Thank you.
Bye.
Yeah. Bye. Bye. Bye, sir. Thank you.